You can write on the TV. So I'm writing the age aspirin, angina, age aspirin angina. You can write down. Then you can write on the ECG, trop T, and coronary angiogram, and lastly the 3 coronary artery disease risk factors. So these are the 7 important points that you need to remember. Yes, my dear, for answering this question, this type of questions, exam, my dear, confidently with the correct answer. So you see, if the score is written, if the score is 1, that is 4. Score 2 is an 8. Score 3, say for example, this is 12. So that you can remember, my dear. And score 4, this is 20 rather than 19. Score 5, this is 25. So and score 6 to 7 means the 6, 7. So this is nothing but the 40. So if you write down another SS box here, so these are the SS boxes will be helpful, my dear. So yes, the score you can write on the 1, 2, 3, 4, then the 5, then 6 to 7. So this is important to know, my dear. So 1 is a 4%, 2 is a 8%, 3 is a 12%, then 4 is a 20, 5 near about 25, and 6 to 7 is nothing but the 40. So you must remember these things, my dear, so that you can give the right answer. So you see, 1, 2, 3, 4, 5, 6, 7, the 7th score. As I said, the age, angina, and aspirin. Age, aspirin, and angina. You need to remember. And next is definitely you should think about the ECG changes, then the trop T and the coronary artery disease, more equal 50%, and the risk factor more than 3, more equal 3 risk factors, at least the 3 risk factors. So these are the 7 scoring, my dear. So if the score is 1, 1, 2, 3, 4, 5, 6, 7, and once again the 4, 8, 12, you can remember 4, 8, 12, 4, 8, 12, 20, 25, 40, 4, 8, 12, 20, 25, 40, 4, 8, 12, 20, 25, 40. So you need to remember, my dear. So this is important. So these are the 2 boxes. Knowing these facts of this first box, as I said here, and the second box I have said here. So these will be helpful to give the right answers correctly with confidence, my dear. So getting back to the question scenarios once again. So the 66-year-old man, as I said, the age more than 65. So you got in 1 score. Yes, my dear. So this is important. The 20 packet history of the smoking one of the history with 2-hour history of the central chest pain. He had never, so the smoking circle, the smoking, and the 2 hours history of the anginal chest pain. So the angina. So you've got the 1, 2. He had never had this pain before. 12 EC shows the ST depression. The 3, once again, the scoring you see of 2 millimeter in the anterior chest lid. He was not taking any medications and had not been to the GP for 10 years. He was adopted when he was 3 years old. Means you have no family history. So you found the age, you found the angina, and you found the ECG changes. So almost 3. So you see the 1, 2, 3. So 3 score is near with the 12. So here's a 13.2% risk. So you got the 3, my dear. So this is important. So you see that you can easily give you the right answers correctly with confidence. So other than the smoking, if there is a hypertension, diabetes, family history, hyperlipidemia, cholesterol. So yes, in that case, the score will be increasing. So in that 4 that you see the 420, so you can remember. So once again, 1, 2, 3, 4, 5, 6, you remember that. 4, 8, 12, 20, 25, 40. So in this box, and if you know this box very well, you can get the right answers correctly with confidence. So these are important things, my dear, know. So if the questions are coming from this scenario, you will do the best, my dear. I believe in that way. Next question number 2, once again, let's get back here. So you see, what would you prescribe for the patients prior to the coronary angiography? So what would you prescribe for the patient prior to the coronary angiography? So the answer is that you see the aspirin, clopidogrel, aspirin 300, prasugrel 10 milligram, and once again aspirin 300 and prasugrel 60 milligram. So this is the answer is written here. So let's get back to this explanation first before moving back to the question scenarios. The patient is most likely experiencing the acute stent thrombosis. So this is important, acute stent thrombosis. As she is already on clopidogrel, and there may be some degree of the clopidogrel resistance or failure. So that's why the stent thrombosis has been happening. So another antiplatelet may therefore be used, and there is enough data to support the prasugrel use in these situations. So yes, as this clopidogrel, the use of prasugrel requires a loading dose followed by maintenance. The loading dose of prasugrel is 60 milligram and maintenance is, so you need to know that loading dose is 60 and of course the maintenance dose is the 10 milligram. So the clinical indications for the use of prasugrel, that's important, the indications of prasugrel. So the patients with acute STEMI undergoing PCI, yes, so you need to learn the PCI. And patients with a definite stent thrombosis, so the stent thrombosis, you can write the ST during the clopidogrel treatment. So our patients in these scenarios, the patient is presumed stent thrombosis during clopidogrel treatment. So this is important. So the definite stent thrombosis and presumed stent thrombosis, these are the two that are the stent thrombosis. And patients are at risk of developing stent thrombosis, high risk. So once again, the stent thrombosis. So these three are the stent thrombosis. And those presenting with the acute coronary syndrome, so yes, another one is the ACS with diabetes mellitus. So the use of prasugrel is important, my dear. So we can write in SS box here of prasugrel indications. Indications of prasugrel, my dear. Definitely the acute STEMI. So you're writing the PCI, prasugrel is the PCI, and definitely the acute STEMI. And second one that you need to remember, the stent STT. I'm putting the stent thrombosis and STT, stent thrombosis. Definite stent thrombosis during clopidogrel treatment means the patient is on already clopidogrel treatment and presumed stent thrombosis or the high risk of stent thrombosis. So the three important things in the stent means the stent thrombosis is the indications of the loading dose that the clopidogrel 300 milligram and of course the prasugrel 60 milligram, 300 by 60. So you need to write on 300 by 60, my dear. So now come back to the another important, the ACS. Yes, my dear, ACS plus diabetes mellitus. So these are the three indications that you need to learn, this SS box that I'm giving here. So the prasugrel indications, definitely the loading dose should be used in that cases that you need to remember the three important things, my dear. Acute STEMI, definitely acute STEMI undergoing PCI. So the PCI. Second one is the stent thrombosis and third one is the ACS with diabetes mellitus. So once again, PCI, prasugrel PCI, loading dose. And second one, I'm telling you, yes, my dear, the stent thrombosis during clopidogrel treatment. And definitely the third one, as I said, the ACS with diabetes mellitus. So this is the box, my dear, that you need to learn very well. Yes, my dear. So getting back to the scenarios now, you can get back to the scenario. This is also, I must say,